Hello, everyone, and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communication Service, and Multicultural New South Wales. We're pleased you've joined us here again, and we're so glad that you're sticking around and making sure that you hear the COVID-19 updates and ask your questions from Dr. Jan Fizzell, our New South Wales Senior Medical Advisor. And also we have a special guest today. We have Dr. Christine Selvey, Director of the COVID-19 and Influenza Branch of Health Protection New South Wales. So we're glad they're here today to answer your questions. And our topic and focus today is on vaccination of COVID and flu. So before we begin, we'd like to acknowledge the traditional owners of the land from which we are all meeting today. We pay respects to elders past and present and emerging. And we also, of course, acknowledge the traditional owners of the land. For Dr. Jan, Dr. Christine, and myself, we acknowledge the traditional custodians of the land, the Camaragal people of the Guringai tribe of the Eora Nation. We also pay respects to multicultural leaders and elders who are represented in this meeting today. We encourage for you to please ask your questions to the chat. As always, we only have 30 minutes for this Zoom session, but of course you can always add your questions and on the chat. Please put your name on the chat as well and let us know where you're joining us from today. So throughout this session, my multicultural colleagues from the Multicultural Health Communication Service, from Multicultural New South Wales, and the Ministry of Health will be putting in some links, relevant links to multicultural and multilingual resources available for you on COVID-19. So shall we start? Dr. Jan, how are you today? And Dr. Christine Selvey, thank you so much for joining us.
It's my pleasure, thank you.
Yes, Dr. Jan, would you like to give us an update?
Yeah, so today we've had 95% of people aged 16 and over who've had one dose of a COVID vaccine, and 94.8% of people have had 2 doses of the COVID vaccine. We still really want to get that booster rate up. We've had 62.5% who've had a 3rd dose of COVID vaccine of people who are eligible for a booster, but really important as we're going into winter that please people take up that booster vaccination. We also have only 50% of our 5 to 11-year-olds who are vaccinated. So again, really important we reach out to parents of young kids and encourage the uptake of the vaccine. And for our 12 to 15-year-olds, 83% of kids have had their 1st dose of vaccine and about 80% have had 2 doses. So still some room there for improvement amongst that age group, especially as we go back to school. We had nearly 12,000 positive test results yesterday with 6,401 positive rapid antigen tests and 5,538 positive PCR tests. But we still would like to remind people to keep COVID safe. COVID is still definitely very much around us at the moment. So please use a mask in indoor settings, particularly when you can't physically distance from others. We're not wearing a mask today so that you can see us talking clearly, but normally our masks are on even we're here at work. It's important to get the booster vaccine, and of course if you're unwell, do get tested and stay home until you get the test result and that you are well. So we've got a few viruses circulating at the moment that are causing respiratory type symptoms, and it might not be COVID, but it could be something else, and it's really important that we try and minimise the spread of respiratory disease this winter. And unfortunately, we did have recorded 21 deaths yesterday, 11 men and 10 women, and we'd like to give our sincere condolences to those families and the families of all those people who are being touched by COVID at the moment. Thank you
so much, Dr. Jan. It's a pleasure to be back here after 2 weeks of the public holidays, and we're back. So thank you everyone for joining us. We'll start with the questions. With the new household rules, with isolation rules, there's been some questions about uncertainty on those rules and the recent changes. How could people follow that, and why has it been changed?
Look, I think it's really important that people realise that if you've had COVID in your household, there's a very good chance that you will develop COVID in the 2 weeks following your exposure to COVID in that household. And so whilst we understand that there's COVID circulating in the community, it is important that if we have been in close contact with somebody who has COVID-19, we do move through the community in a respectful way as much as possible. So that means wearing a mask. If you leave the house, you should wear a mask. If you have any symptoms whatsoever, get tested and isolate as well. if you can work from home or attend school from home, attend work from home or school from home. Don't go back into a workplace. And if you do need to go back to work or school, make sure people know that you have had that exposure to COVID-19. Also, please make sure that you are doing your best to stay away from aged care facilities, disability care facilities, healthcare facilities, simply because we do have a congregation of vulnerable people there, and it's really important that we don't accidentally take COVID in by visiting. Similarly, if you have a relative in a disability care facility or an aged care facility, please don't take them out for an outing with you having been a recent household contact, so that we don't accidentally spread it into an aged care home. So it's good that we can still do things like, you know, there's probably not a risk of, you know, going and picking up some milk and bread through a drive-through place, but it is really important that we do behave responsibly now that we've got that opportunity to leave the house.
Thank you so much, Dr. Jan. And also, that's why Dr. Christine Selvey is here. The question about the flu. Russell Anderson from NEMBC is asking, is there any research or findings of people getting COVID and flu at the same time?
So there is some, we do know that that is possible, and people can have flu and COVID at the same time. But the data and information on how severe those infections are and what that means in terms of transmission is still coming in. But definitely that can happen. Fortunately, the way to prevent flu and COVID are very much the same in terms of respiratory viruses. So all the things that Jan has just mentioned and that we all know about now around mask wearing and social distancing and hand hygiene, and most importantly, staying at home if you are sick.
The vaccination for flu, because of that is available now.
Yes, it certainly is available now. And it's what we have seen over the last 2 weeks, and particularly the last week, is we have seen a pretty rapid increase in flu notifications. So we think that this is possibly an early start to the flu season. So we really urge people, now is the time then to get vaccinated. And as I say, you can have the flu vaccine and your COVID vaccine at the same time if both are due. What we have seen is that there's a lot of flu in young children, and we know that children under 5 years of age are at risk of getting serious influenza disease. So unlike COVID, where children generally have very mild disease, with flu it can be very severe, particularly in young babies. And the other issue with the under 5s at the moment is because there was no flu in last year in 2021 or the year before in 2020, those babies or children under 3 have had no exposure to flu, so they won't have built up any natural immunity. So it's quite likely that, you know, they're at even higher risk of severe disease than prior to COVID. So really important message for children under 5 years to go and get their vaccine. Flu vaccine is free for children under 5 years. It's also free for people over 65 years and for all Aboriginal people and for anyone with a chronic disease that puts them at high risk of severe flu. And so I really urge, please to go out and get your flu vaccine now. It's recommended for everybody, not only the funded groups.
Thank you, Dr. Christine. One of the things that people are asking is there a difference between the flu vaccine and COVID-19 vaccine? Dr. Jan, we're always promoting the COVID-19 vaccine. Now we're promoting a flu, and I'll pass it on to you. But Dr. Jan.
So they're quite different technologies and how they're manufactured. The flu vaccine is particularly matched to which strains of flu we see circulating in the other part of the world, because flu tends to come to us from the Northern Hemisphere, and we try and match it with what's going around in the Northern Hemisphere so that it has the most effect when it's being used here in Australia. With the COVID vaccine, as you know, we haven't been changing it. It's still there. But what we do know is even though it hasn't been changed, we may do better when we get new vaccines, but but we've got what we've got at the moment. It's really good at preventing severe illness, hospitalisation, ICU admission. It's got less of an effect on transmission now than it did with some of the previous strains, but it still has some effect on transmission. So with the COVID vaccine, you're protecting yourself from severe illness, and we're still learning about our vaccines. Flu is a really well-established vaccine, and for the over 65s, there's even a special vaccine for them, which has got what we call an adjuvant, which helps the vaccine work even better, because as we know, as with COVID, where as you're older, you need more more stimulation of your immune system because it forgets what it's been exposed to before. With flu, there's a particular vaccine for over 65s, which GPs have got good stock of.
Thank you, Dr. Jan. But Dr. Christine, what about having them together? Are there any symptoms? And, some people have side effects. For example, they don't feel well. Having two vaccines, will that affect someone's immune system, how they react to the vaccines?
Yeah, we don't think so. And part of the way back at the beginning, when we didn't know much about the COVID vaccine, there was a recommendation to wait 2 weeks in between for that very reason, about potentially getting some side effects from the vaccines. But the current thinking is that that's not an issue, and it's actually just important to make sure that people get vaccinated, and having them on the same day, is an efficient way of doing it.
Well, it's good to know that it's sufficient and you can take it at the same time without having to go at different times. So thank you for that, Dr. Christine. A question here from Janie Tam from 2AC Chinese Radio. How can we encourage the young people to do the booster vaccine, as most of them are not likely to do it?
Look, I think what we really need to do is explain to young people that we still see some fit, healthy young people really sick in hospital with COVID, but also young people move through the community. They are such a pillar in so many families, real glue, helping with kids, helping with older people. And so one of the best ways we can protect them and help them protect other people is by vaccinations. So I think it's really important that we don't just, write it off and say COVID's not important anymore. Young people aren't getting really sick. They can still get really sick. It does, still reduce a young person, admittedly small chance of hospitalisation from COVID, but it does reduce it significantly more.
I guess the same question is for young people, because flu is around. It's also the same thing to encourage people to get the flu vaccine. Dr. Christine.
And exactly the same rationale. So whilst young children, as I said, can get serious illness, generally young people, so older children and adolescents and young adults generally don't get severe illness requiring hospitalisation or ICU admission, but it can happen. And certainly people can end up, pretty sick and having to take time off work and in bed for a few days. And so that's not a pleasant thing. But also with flu, and this is why we strongly recommend that all healthcare workers and aged care facility workers are vaccinated with influenza vaccine, is it does then help to protect people around you. So exactly the same rationale as or reasons that Dr. Jan has just explained apply for flu vaccine.
Thank you so much, Dr. Christine. Fatin Dana from 2MFM Arabic Radio broadcaster has said that we are encouraging people to take the booster dose. But yesterday she said that she spoke to one of the secondary school teachers, Dr. Jan, and she was informed that she got sick after the booster dose and all of the symptoms of COVID-19. She felt it and was sick for 5 days. The school teacher had tested negative before taking the booster, and she thought it would keep her safe and it would be safe, but it made her very sick. Comments on this?
So one of the things is that we've got so much COVID, so much, and now increasingly so much flu and other respiratory viruses, that it's not uncommon that when we're vaccinating a whole lot of people each day, that some of those people will actually have picked up something else at the same time. And so you can be sick with something else having had the booster. Most people with the booster, their symptoms, if it's related to the booster, are over within 72 hours. You don't tend to get a runny nose with it. You're more likely to be headachy, achy, maybe have a bit of a fever. So it's more likely for this poor lady that she's actually managed to pick something up at the same time as when she had her booster. And, it's a bit of an old wives' tale about flu, that if you have the flu vaccine, you get flu. You can feel a bit off for a couple of days. But again, it can't give you flu.
Thank you so much, Dr. Jan, and thank you for our journalists putting in your questions. Please do add more questions because we've got two great experts here to answer all of those questions for you. Dr. Christine, the flu vaccine is free for a certain age group. Why is that? We've asked this before, but just wanted to ask from you. Why is it COVID-19 vaccine is free and the flu vaccine is not?
Yeah, and I guess the funding for flu vaccines started long before COVID even existed. So it is funded for those people who are at the highest risk of getting severe disease. But as I've just said, sometimes people who are at lower risk still can get serious disease, and it is recommended for everybody, although not funded for everybody. Fortunately, in the scheme of things, flu vaccine is one of the cheaper vaccines. But not necessarily, some people, it's still an expense for some groups. A lot of workplace programs will offer flu vaccine because that helps the workplace with having people absent from work and on sick leave. And so if you're lucky enough to be in a workplace where it's vaccinated, really strongly encourage you to uptake that provision of vaccine in your workplace.
Thank you so much, Dr. Christine. There's a question here. Does the flu vaccine protect people against COVID and vice versa?
Wouldn't it be nice if all the vaccines protected us from everything? But unfortunately, no, they're very different viruses. And so our immune system has to learn how to recognize and basically stamp out those very different viruses, which is why at the moment the COVID, and I say at the moment because one day we may have combined vaccines. There's all sorts of thoughts about what might happen in the future with immunisation. But at the moment we have a COVID vaccine that fights our COVID virus. We have the flu vaccine that fights our influenza virus, and they don't fight each other. And even it's about our fact that our body only has so many ways to respond to different illnesses. It does tend to make us, hot and cold, achy, give us a runny nose and give us a sore throat when we have exposure to a number of different viruses. It's about how our body responds to the virus, not the fact that the viruses are actually very different in themselves. And so, again, we've got the COVID vaccine for the COVID virus, we've got the flu vaccine for the flu virus. And one of the biggest differences, of course, is with the flu virus, unlike COVID, where we've only got it for kids aged 5 years and older, with flu, it's from 6 months. Yeah.
Yes.
Yeah.
So funded from 6 months to 5 years.
Yeah. So it's particularly important that, parents who may not have been worried about getting their child vaccinated for COVID because there's been no vaccine available, they can make that trip and get their kids protected, particularly because, as Dr. Selvey says, it's a very nasty illness sometimes in young kids.
So Dr. Selvey, how can we convince, and how important is it for the parents and for us to be convincing parents to get their kids vaccinated against flu, especially at this time?
Well, it's very, very important. And as I said earlier, we think that this year it's even more important than prior to the COVID pandemic, because none of the young children will have been exposed naturally to natural infection. And so it's very much the babies in the past, but probably this year, right up to 3 years and including the 4 and 5 year olds who may end up getting even more serious disease than in previous years. The other way for protecting young babies is vaccination during pregnancy, which is totally safe and is very effective in then passing on antibodies from the mother from the vaccination through to the baby in that first 6 months of age, through the placenta and also through breast milk. So also very important for pregnant women to have flu vaccination. It will then, pregnant women are, like with COVID, are prone to getting serious disease themselves, but also then those antibodies will then pass on through to the baby, and that's very important for flu.
Thank you, Dr. Selvey. A question from Russell Anderson, again from NNBC. As we move into winter, is there any expectation that we will see a rise in COVID-19 cases, even though we have a large proportion of the population vaccinated? Dr. Jan.
Look, I think we know where COVID likes to spread. It likes to spread when we're indoors, close together. And we have a number of people who were either impacted by Delta or impacted quite early by Omicron, who's, you know, if you like, boost because of being actually exposed to the virus is starting to wane. So the thing that we can do is if we have a readily boosted population or recently boosted population, we may not see that increase in winter that has been seen overseas, but we are certainly watching for it. And as you know, anyone who turns on the news at the moment can see, you know, there's always concern, what's the next variant? Is it going to be worse? Are our vaccines still going to work? So I think we're going to need to maintain a vigilance through this winter between COVID and flu. Plus, you know, also really important though, that for a lot of people who may not have been engaging with their regular care with their doctors to, you know, get back to making sure that they have got their diabetes checked, to make sure that they've, you know, had their blood pressure checked, if they're, you know, eligible for screening, get their, you know, cancer screening up to date, whether it's bowel, cervical or breast cancer screening, and getting back into care. So, you know, for a lot of people, it's probably not a bad idea at the moment to start thinking about booking an appointment with your doctor to say, particularly if you haven't seen them face to face for a while, to say, I need, you know, how am I going? Are my medications right for me? But also coming into winter, do I need to think about antivirals if I get COVID, because we've now got those medicines available, or even do I need to think about treatment for flu if I get flu? And so having that winter plan done and getting yourself into the best condition you can going into winter is probably a good idea for, you know, nearly all of us.
And I think Dr. Jan, with saying that there are COVID requirements for international travel, including visitors arriving from overseas, there are vaccination and isolation rules that come into that. And so there's people traveling overseas and there's people traveling here. So we need to also, when we travel, getting the COVID-19 vaccine, but also the flu vaccine. Is that an advice that we should be giving?
Oh, definitely. That's always an advice about getting flu vaccine before you travel. And it's not the right time of year now, but generally in around November, December, we often will do another campaign about flu vaccination for people who are going into the Northern Hemisphere for holidays over Christmas or in January, so that they're protected in the flu season in the Northern Hemisphere. So yes, flu is, and you know, you don't want your holiday interrupted by getting sick. So definitely leading into that summer, traveling our summer, winter over, but seas where people often travel, flu vaccination is recommended. And even if it's a second dose for that year.
Thank you so much. A question here saying that regarding people over 65 being charged for the fluid quad vaccine at pharmacies, there are additional reports of people being asked to pay at pharmacies. The New South Wales Health site indicates pharmacists may charge an administration fee for vaccination, although the vaccines are free. Why does this happen?
Look, I think what we know is that pharmacies, like many other groups in the world, are businesses, and it does actually take time of a pharmacist to be able to prepare, check your eligibility and administer that vaccine. So I think that, you know, there are some pharmacies where people will be charged for that service, some may not. But I think the key thing is if you're concerned, talk to your GP, and your GP can give you guidance, because some GPs will also have clinics at their practice where they'll bulk bill if they need to consult with you, or have a practice nurse do the flu vaccine. So I think it's just important to ask around and see where you can go. But if you've got a pharmacist that you know, trust and knows you well, the administration fee may well be worth it for you.
Thank you, Dr. Jan. And I think I'd like to go back. There's a question that goes back to the antivirals you were saying. So the minute that you get COVID, if you're high risk, you should talk to your GP immediately. Is that correct?
Yeah. So there are certain groups that we know are higher risk of becoming hospitalised or winding up in intensive care, people with severe suppression, people who are older, some chronic illnesses, and those people are eligible for medications that have been listed on the pharmaceutical benefit scheme. So they've been subsidised, they're available at pharmacies. And so your GP may do a telehealth consultation with you and may issue a script. Now, I was lucky enough, my script can come sometimes over my phone, and then I can take that to the pharmacy. Or if I've got COVID, a member of my household or somebody, a friend who isn't affected, can actually take that script to the pharmacy, get it filled, and then I can start taking that medicine. That medicine works best if we start it within 5 days of first getting symptoms or testing positive. So it is really important that we get onto it and don't wait till people get really quite sick, because that medicine doesn't work so well once you're quite sick. There are different medicines we can give you. There's definitely treatment we can give you, but the sooner you start those medicines, the less likely you are to need those other interventions.
Yes, Dr. Jan, you mentioned about telehealth and virtual care. That is available for everyone, whether you have the flu or COVID-19, isn't it? And then there's available services in language as well.
Yeah, that's right. So basically, the rebate for telehealth is continuing. But the other thing is, particularly for COVID, less so for flu, but particularly for COVID, if you look at the testing positive for COVID-19 fact sheet, which is available, I think, now in 50 languages, it gives you the number that tells you who to call if you're concerned. So even if you're having trouble registering that rapid antigen test result, or you live in regional New South Wales and the PCR testing capacity isn't there till tomorrow and you've had a positive rat, please call that 1-800 number. They can link you into care. And if you don't have a GP or your GP isn't willing to work with COVID, then they can also try and help you link into a network to help you get a script or even help you get the drugs.
Dr. Selvey, if everyone is sick, people get confused of having COVID or the flu. As you said, it's around now. How should we just go to our GP and just get advice?
Yeah, so people, especially people who are at risk of getting severe disease, and so those groups of people, as Jan's explained, around people who have immunosuppression or some chronic illnesses, people who are older and people who are unvaccinated, they should get a test if they're unwell to work out whether it is either flu or COVID or something else, because of those antivirals being available for COVID. There are also other antivirals that work in the same way for influenza, so that if those are started early on in the disease, and the earlier the better, as Jan has said, then that can prevent severe disease and hospitalisation. So important that people who are at risk particularly do get a test for flu or for COVID, so that they can then have those antivirals prescribed for them.
Thank you so much, Dr. Selvey, and it's wonderful to have you here. We have run out of time, but as you can see, there's some links that sent through by our colleague Gaia Damagesan on your chat, and there is a campaign coming out and more resources in language for flu and information for you. But before we go, Dr. Selvey, any last words for the audience here today?
Yeah, so just to repeat that message, that we do think that flu is starting to take off in New South Wales. It's important that people get their flu vaccine now, and particularly children under 5 years of age get flu vaccine. So 6 months to 5 years. Pregnant women also will getting vaccinated will protect themselves and their baby, and then the people over 65 as well. Thank you.
Thank you so much, Dr. Selvey, for joining us. Dr. Jan.
Look, and I think that message about getting ready for winter is really important. Flu vaccine, making sure that if you need the COVID booster, you've had your COVID booster, and thinking about having a quick chat with your GP about, if I get COVID, if I get flu, do I need to call you urgently to see if I need medicine? And I think that's really important, because the more people who are ready, the easier it will be if we do wind up with a bigger flu or COVID season.
Thank you so much, Dr. Jan. And thank you very much, Dr. Selvey and Dr. Jan for being here today. And as we know, you're holding this Multicultural Media Online Forum every fortnight from now on. And we hope you can join us on the next conference. And that's on Wednesday, the 18th of May, same time, same Zoom link. Please keep it in your diaries. The recording of the briefing will be available on the New South Wales Multicultural Health Communication Service website. We'll also have some notes from this meeting today, and we'll send that through to you. And if you want that in advance, let us know. Thank you so much. As Dr. Selvey and Dr. Jan said, please keep COVID and flu safe. We'll take care and we'll see you again next time.